Hi, I'm Tanisha Carino from Avalere Health. I'm the Executive Vice President. Avalere Health is a strategic advisory services firm and research organization here in Washington, D.C. I'm pleased to be at this event today. Today, we're really talking about what 2014 has accomplished to date as it relates to the establishment of the exchange plans. And 2014 was a really big step forward as it related to getting an exchange market up and running, seeing higher than expected enrollment, 7.1 million have enrolled to date, and really starting to understand what types of products will be available for patients that need insurance. When it comes to the products that patients are going to be part of and the plans that they're signing up to, we're really seeing some differences between what is covered in the exchange plans and the experiences that patients in the exchange plans may have that may be different from those in the commercial plans. For one thing, we're seeing exchange premiums be relatively more affordable than we originally had thought. And because of the regulations on the benefit designs, these products are relatively more generous than what we had seen in the individual insurance market previously. As it relates to the coverage of pharmaceuticals, what we're also seeing, both for physician-administered and self-administered pharmaceuticals, is we're seeing that the coverage of these products is relatively the same between the employer and the exchange market. But where there's a difference is in the type of cost sharing that is going to be applied, the type of utilization management tools, and the deductibles that patients are going to see in the exchanges that are relatively higher than what we see in the employer market. So moving forward, I think that there's plenty of opportunity for the patient community to really refine what types of products are going to work for them. And the two major areas that I think are ripe for additional refinement are in helping understand the type of network adequacy requirements that are needed for exchange plans. So for example, particularly in the oncology community, are the top cancer centers, the NCI, NCCN centers, included in the exchange plans? And should there be more federal oversight to ensure that some of these centers of innovation are included in exchange plans moving forward? Second, there are numerous areas around making exchange products more transparent as it relates to the choices that patients are going to have in choosing the right plan that works for them. For example, only 2 states have a searchable tool that allows you to put in your provider and make sure that the plan that you're choosing actually includes the provider that you've been seeing. In only 1 state, you're able to put a drug in a tool finder and make sure that the pharmaceuticals that you may be on are also covered in that plan. These are just 2 examples of where there's definitely a refinement that needs to be made as it relates to making the choices that patients have to make more transparent. So what keeps me up at night is the balance between making these choices affordable, keeping premiums low, but still ensuring that the products and the plans that are provided to patients really meet their needs. And that's what we'll be looking for, that balance between affordability and generosity moving forward.